Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Defenses against negligence. No duty owed to the patient, that is, no doctor patient relationship. If there is no doctor patient relationship, the patient cannot put any negligence suit. Second, doctor discharged the patient as per the prevailing or acceptable standards. Third, contributory negligence. The doctor has informed the patient to do something, but patient did not do it, and as a result, the patient has a result. This has resulted in damage. So that is contributory negligence. Contributory negligence is only for civil cases. Patient negligence. 5. Medical maloccurrence. Because of individual or biological variations, in spite of due care and precautions, a particular treatment or procedure or drug will have the effect which it is supposed to have, will not have the effect which it's supposed to have. On the contrary, it has a damaging effect. For example, just sometimes because of the individual variations or any variations in the individual, there can be the drug or procedure may not have worked. So, for example, test dose given to a patient before an antibiotic, and there is no reaction to the test dose. So, full dose is given to the patient, for which the patient develops the reaction. So, this is medical maloccurrence. 6. Therapeutic misadventure. In therapeutic misadventure, for example, if there is a case of snake bite for poisonous snakes, the treatment of snake bite is anti-snake venom. The patient is given anti-snake venom. Then the patient started reactions. Here there is no alternative. Some cases Here there is no alternative. The doctor has to continue the drug or treatment to in order to prevent the poison from the snake, despite the despite of which the patient has reaction. So in this case, the damage or worst for this damage and worst outcome, that is for this reaction, the doctor is not held responsible. Diagnostic misadventure. In diagnostic misadventure, example, in contrast CT scan, a dye is injected in spite of taking precautions. If the patient suffers, it is diagnostic misadventure because there are some side effects which cannot be avoided. The doctor is not responsible, and the doctor has to prove that he has taken all the precautions and there is no alternative for it. Experimental misadventure. Experimental misadventure deals with human trials patient or person, and it gives a voluntary consent to participate in drug trials. Experimental misadventure mainly deals with human trials. In human trials, the patient or person gives voluntary consent in order to participate in the drug trial or experiment. If during this drug trial or experiment, if the patient develops some reactions leading to damage, then the doctor uh, is not responsible because the doctor has already explained everything about the adverse effects of the drug prior to the trial. 9. Novus actus intervenus. If there is new act intervening or unrelated act intervening. Here, doctor has done a treatment, and a completely unrelated act has intervened in between, and this has resulted in damage to the patient. Here, doctor is not responsible.
Thank you and thank you for watching.